COVID Alert is a smartphone application that can let you know if you've been exposed to someone who has COVID-19. It's completely anonymous, doesn't use location, and is privacy protecting. The app uses Bluetooth as you're going about your day to look for other phones that also have the application installed. And when you're within 2 meters for 15 minutes or more of another phone that has COVID Alert, your phones are exchanging these unique identifiers that are completely anonymous so that your phone is creating a log of all the people that you've come into close contact with. And then when someone is diagnosed with COVID-19, they receive a one-time key from their public health provider that they then enter into the app. And that key, aptly named, releases the codes that they have been collecting as they've been going throughout their day. And then, once a day, all the other phones that have COVID Alert are downloading that list of codes from people that have been diagnosed as positive and checking to see if there's any matches, because that means that they were in close contact with those folks. And if there is a match, then that person will receive an exposure notification saying that they may have been exposed to COVID-19. And from there, they follow the embedded guidance that is particular to whatever jurisdiction that they're in. Again, completely anonymous, totally privacy protecting, and it's just one additional tool that we have in our toolkit to help stop the spread of COVID-19.
COVID Alert is an exposure notification app that's built off the Google Apple framework. That means it works on Android and Apple phone devices that are newer than the last 5 years. And that's because the Bluetooth technology that is embedded into those phones that enable the whole process to work. So this is an app that is built with privacy from the start and accessibility in mind. And the way it works is that when you're out and about, your phone will collect and or send random codes to other phones that also have the app installed and Bluetooth enabled. And what happens here is that your phone will then collect those codes. And that's the only thing that it collects. So it has no geolocation data, it doesn't know where you were, who you were around, when you were there. It doesn't access any of your personal information on your phone. It has less access than Facebook, Twitter, or TikTok does to your settings or information that's on your phone. And what happens is that when you or someone who you were around tests positive and they enter that one-time key into the app, you then have the ability to share with everyone that you may have exposed that they have been exposed. And this gives you an indicator to change your behavior, to go get tested, to look out for symptoms, depending on what province you're in and what information, because it's a national app. So it works everywhere in the country, regardless if a province is onboarded or not. Provinces that have not yet onboarded, the big difference is that they can't give a one-time key. But you still can be aware that you were exposed to someone who has tested positive and that you can course correct your behavior. And it enables us to slow and help stop the spread of COVID-19 in Canada.
COVID Alert complements other contact tracing processes. The purpose is to alert people to let them know if they've been near someone who later tested positive for COVID-19, and then give them guidance as to what action they should take depending on the province or territory that they're in. It uses a new framework that's on Apple and Android phones that uses Bluetooth and is constantly pinging all the phones around you. So your phone is sending out an anonymous ID, or anonymous key, to all the phones around you, and it's also maintaining a list of the anonymous keys that it's receiving from all the phones that it's near. Several times a day, the app downloads an updated list of the keys of people who have tested positive, and it compares that list to the list that it's been maintaining of the phones that it's been near. If there's a match and it's of a close enough proximity and long enough duration to be determined to be risky, then it notifies the user that they've been exposed to COVID-19.
COVID Alert helps you know whether you've been near someone else who also has the app within a 2-meter radius for more than 15 minutes. It does this by exchanging random codes every 5 minutes, and these random codes are always changing so they can't be used to identify you. The app runs in the background and won't disrupt any of your activities, but I have heard some people say, won't having Bluetooth on all the time in the background drain my phone's battery? Well, not in this case. COVID Alert specifically uses Bluetooth LE. The LE stands for low energy, so running Bluetooth all the time in the background 24/7 on your phone has a negligible power consumption on your device. It's actually much less than using your camera and most social media apps for an hour. And on valuing people's privacy, we kept that at the very core of our decision making. We know that trust is earned through demonstrated actions each time someone uses a product or service. So we designed the app with your security and privacy in mind. COVID Alert doesn't use GPS. It has no way of knowing your location, name, address, or health information. Ultimately, we knew COVID Alert had to be reliable, consistent, and offer an honest experience. As designers, we aim to be good stewards of our users' data, resources, and ultimately, their time.
COVID Shield was developed by volunteers at Shopify to serve as a reference that governments could use to develop their own exposure notification app. We partnered with them early on, and by forking their code, we were able to save a lot of time because we could then focus on the Canada-specific features that we needed. And while we've certainly diverged a lot from that initial implementation, COVID Shield remains a foundational component of COVID Alert.
There are three pieces to the puzzle that is COVID Alert. There's the application itself, the healthcare portal, and the server. The app itself is the thing that is out in the world and looking for close contacts. So if your phone is within 2 meters for 15 minutes or more of someone else's phone that has COVID Alert, the phones are exchanging random codes with each other. And your app is collecting a log of other phones that you've been in close contact with. And these are potential exposures. If any one of those people have told the app that they reported positive, you would get a notification. So if someone is positive, they need to tell the application that. And they do that through the use of a one-time key. And this key is typically, in most jurisdictions, generated from the healthcare portal. We've worked with provinces and territories to make sure that the healthcare portal is accessed by the right people. So these are typically contact tracers and nurses in public health agencies across the country. And they'll log in, generate a one-time key, which is a 10-character alphanumeric key, and then give it to the COVID positive individual over the phone. That's the typical process. And then that person will then enter it into the app and allow the app to share the codes that they have been collecting. So these codes then go up to the federal server. And each day, every other phone that has COVID Alert downloaded will ask the server, what are today's positive codes? And they do a comparison check to see if any of the codes that they have collected on their phone matches one of the codes that are sent up from the people who have told the app that they're positive. And if there is a match, then they will receive a exposure notification. Then they'll follow the guidelines embedded within the app that's set out by their local jurisdiction. The team was really intentional with how we built COVID Alert to make sure that we were protecting privacy and building trust in the people that were using it. And we did this in a few ways. The first being the framework, the underlying framework that we're using. The Google Apple exposure notification framework was also built on pillars of privacy. And by virtue of the way that it works, we don't need to collect very much information at all from individuals that are using the app. The logging of potential exposures and the matching of real exposures all happens on the phone. So we don't get that information, and we don't need any personally identifiable information, and because it uses Bluetooth, we don't need to use location or anything like that. So the framework for the app gave us a really big leg up on how we were able to protect privacy that some other contact tracing apps that don't use the Google Apple exposure notification framework need to use location and be aware of contacts and things like that we don't have to, which is great. Another way that we were building trust with the application is through the content in the app itself. There was a lot of work and iterations that went into the content to make sure that it was clear and understandable to people that are going to be downloading the app and reading it. And we know that privacy is a really big issue for people, so we wanted to be clear about what the app does and what it does not do, and particularly the things that the app does not know. So it doesn't know your location, it doesn't know your name, your phone number, your contacts, your health information, etc. And we put this information right up front when people are downloading the app, so people can have a solid understanding of what the app does and what it doesn't do, and hopefully answer some questions that people rightfully have about their privacy in using COVID Alert. Another thing that we did was build the app in the open. So there are a bunch of repositories online that anyone can access where they can review the source code of both the application, the server, the healthcare portal, and other documentation about the service itself. This allows people to go in and take a look for themselves and see what the app is all about. And this is indeed the code that we use to compile the app. And what you see is what you get. The version that's on GitHub is the version that is on your phone.
When we started working on COVID Alert, the exposure notification app, one of the key things that we wanted to focus on was accessibility and access and availability of the app. So from the very beginning, we looked at what inclusive governance could look like, what does that mean in terms of accessibility, and how do we apply it in something that's moving quite rapidly with a lot of pressures to actually build upon. So one of the very first things that came out of that was the need to have accessibility be continuous, to be shifted to the left and start as early as possible, and to engage stakeholders. We were able to then actually pick up a few resources from Health Canada who volunteered to help with the app, who were accessibility testers. And we had 4 people who continuously tested the app, all of the development iterations, the PRs that were submitted onto GitHub, and everything that we were cycling into the app and considering. We're looking at it from an Apple and Android perspective in terms of adaptive technology. We were testing with TalkBack and VoiceOver, as well as other accessibility features on the phone. We looked at how far someone could actually zoom something in if they had low vision. What was the readability? When did the app start to break down? From a plain language perspective and understandability and the ability to move from one point to another in the app and truly understand what you were actioning was core. Like, content was one of the key features to being able to say, are people going to understand what we're telling them? Do they know how the app works? And are they going to be able to utilize it? And so we continued this through our interaction design, service design, content design, research, and development, and then having it be prioritized by the product team. So what we were able to do in that regard is we set up like triage tactics where product teams were able to say, yes, this is a critical issue. This is something that will really impact a user's ability to use the app. This is an issue that is moderate. It's something we need to do before we release. But then we could prioritize our way through, and then things that were more low-hanging fruit that were going to be easy to fix, or that we had to wait for other people to put information together. So that way we were continuously keeping that frame of what does it mean to make an accessible app from the beginning and launch something that will work for Canadians. And that became a core construct of how do we know where we are? And so over the 45 days that we were developing the app, we fixed more than 70 accessibility related issues that had been uncovered, either through the accessibility testing or through the large and small scale beta and usability research that brought back findings that enabled us to make the app better for people who needed to use it. Since then, we've actually done another 20 or more accessibility related issues that have improved access to the app in terms of whether something flowed properly, the navigation was easy to understand or be able to be used, and enable people to utilize it better. One of the big wins for COVID Alert was actually publishing a accessibility statement along with the accessibility report. So being very open and transparent about where we are, gathering feedback, and being continuously willing to improve and iterate and make this app better so that it works for people. So you'll actually find that linked on our GitHub as well as on the landing page for the app. And it actually talks about ways that people can work around things that may not work as well as they can based on numerous needs across the app. So in there, you'll see things laid out for whether or not things meet contrast, what is the breakdown for Zoom, and what accessibility compliance we have, which is WCAG 2.1 AA at about 95%, and continually trying to improve upon that. We also provided a community layer for feedback with a dedicated accessibility email address for people who had issues in regards to accessibility, usability of the app, in addition to the other methods in which you can get support. So that there were dedicated channels to improving that. One of the really cool things that I found from this is when we did the large scale beta, we actually got a lot of feedback from families who were people who had multiple people with disabilities on the functionality of the app, how that they were able to set it up across their family and support each other, and that they were able to get through the entire process, that it wasn't cumbersome, and that they were able to enable and set themselves up. And that was a big win for me to be able to see that and start to look at that in terms of a research perspective and insights, and how do we apply that to the work we're doing. And then the next thing is that once we actually went live at 45 days in the end of July, we continually are still looking at it for accessibility. We add new features, we're changing the way the content works, we're changing something in how the app flows, we're assessing it for accessibility. We are considering people's needs and trying to ensure that we build in that inclusive governance. And it's the same reason that we look at access-related issues. And if you're looking at access-related issues, you'll see things like, oh, well, it only works on phones that are more than 5 years old. Well, what does that mean? And what signals can we send, and how can we make people aware of a whole of government approach that impacts community-led and community-driven focuses to get devices in the hands of Canadians to look at adoption and uptake, and to ensure that we're not leaving vulnerable communities behind. And so we take a holistic approach to what that means in terms of inclusive governance, so that we can deliver better for Canadians.
Accessibility is a requirement. It's not a nice to have. Accessibility and inclusive design were massive underpinnings of our entire development process behind COVID Alert. At CDS, we know that inclusivity means that everybody needs to belong, and belonging, in our case, has a strong connection to whether people can successfully and seamlessly use our product or service. Within 45 days, we made sure that the content was being designed in both of our official languages of English and French every step of the way in the app. We also used a collaborative design software called Figma, which enabled our entire team of all of our designers, developers, researchers, policy experts, outreach professionals, and our stakeholders to be right there in the same design file with us, suggesting changes, optimizing based on feedback, and improving the overall experience for users. We knew that we needed to design for the edge cases in order to make sure the app worked well for everyone, regardless of their abilities or their circumstances. So overall, we conducted 7 inclusive design reviews internally, and externally we engaged with more than 6,000 real users through usability testing. They helped give us feedback to make the app better. We flagged over 310 issues in our open GitHub repository where the public could follow along our entire development process. We were able to resolve more than 70 accessibility improvements. We're not designing for a screen. We're designing for people. And our team of designers really took the time to learn and understand all the facets that makes a person whole, especially a person in a heightened state of anxiety using something like COVID Alert. Their emotions, physical and technical needs. We asked what the health and well-being and other measurable outcomes would be that our work might impact, because we're here to do the hard work to make things simple for all of our users. We don't want to push complexity onto the people using what we're designing. So this had a deep effect on content design behind the entire app experience. We know that people are already in a very heightened state of anxiety dealing with COVID, and so the way we take care to present information clearly and thoughtfully is extremely crucial. We didn't want people to second guess what they were expected to do next, and so a lot of our research and design development went into the onboarding experience for the app. Those first few screens that a person has to scroll through in order to understand how the app works, set it up, and know what to expect moving forward. The illustrations on those pages also needed to add to people's overall understanding and not confuse them further. Based on all the user feedback we gathered, we knew we had to shorten the onboarding experience and create a section in the app that people could access later if they wanted to learn more about how the app works in detail. Because we had 45 days to design the app from the ground up, we used tools like Trello to keep all of our work in our backlog more organized. We tagged people into cards with detailed tasks and checklists to keep track of everything. We were set up as 3 teams, or pods as we call them, working in tandem on different parts of the service.
When we're building services for people in Canada to use, we need to make sure that they are secure. So for COVID Alert, obviously security is of utmost importance, even though the app is super focused on privacy and there's no personal data that we're collecting from people. There is a lot of risk with the application and the potential for harm if people are entering one-time keys and triggering false exposure notifications. So we need to make sure that the server is really secure, that the portal is really secure, that the app itself is really secure. So of course we have our regular government-sanctioned security assessment and authorization processes and all of that stuff. But in addition, we did 3 security reviews, one from the Canadian Centre for Cybersecurity, the Office of the Chief Information Officer within the Treasury Board of Canada Secretariat, and from BlackBerry. And from that, the team was able to flag any potential issues early and work to fix them so that when we delivered the product and people in Canada started using it, we were confident that it was secure and would be able to meet the needs of people.
Security is important to some extent on any project, but for us building COVID Alert, it was critical. If somehow our database where we store the diagnosis keys became compromised, then Canadians would start receiving false alerts saying that they've been exposed to COVID-19. Now, this would lead to a breakdown in trust in the app, and Canada would lose an important tool in slowing the spread of COVID-19.
When you're working on a service where you've got 60 federal partners and 50 provincial partners, that's a whole lot of coordination and communication that needs to happen. So we relied on having processes and procedures in place, like how to approve a design change or what the handoff from research insights to design iteration to developer implementation looked like, so that we could focus on the core of our work, which was championing user needs. We worked in 2-week sprints so that our goals were very clearly articulated for the 2 weeks of time that we were working on things, and everyone knew what we were driving towards. Every 2 weeks, we also held team retrospectives in order to discuss what was going well and, importantly, areas that we could improve.
Working on designing this app was one of the more rewarding moments in my career. It was amazing to see a multidisciplinary team come together with private stakeholders, multiple provinces, various levels of government, all just kind of coming together and accumulating to what was this going to be and how were we going to drive it and make it with a design-led perspective that was going to be accessible and inclusive and usable by as many people as possible in a way that people could understand. And the way that those disciplines all work together in terms of content design, service design, interaction design with research and development was this truly amazing thing. And just bringing in people and getting supports and having like people who volunteered to work on this project. And it was a really fast-paced moving thing with a lot of hours that went into it. But the collaboration across these teams of people, the people like being able to reach out and talk to each other and just bounce things off in the moment and just being able to make the best choices that we could and then like sit back and then review that together and say, okay, these are why we made these decisions. These are who they impact, and actually looking at it from points of exploring possibility and what are the points of exclusion and how do we build in more inclusion was an amazing thing to see.
The biggest surprise for me when building the service was how invaluable the people that participated in the beta testing were. We saw that from doing the beta testing, which had some 6,000 participants, it allowed people to get a sneak peek into the app and to understand how it works. And we saw some of those people become advocates of the app. And of course, when the app was released, there's lots of chatter about it online. There's lots of questions that people have about the privacy and the security of the application and what the government knows about you and all those things. And we found people that participated in the beta test were able to respond to those. And that was really neat to see that there were already folks that had done a lot of research into the application, had already looked through the source code, and were able to say that they, as a private citizen, would vouch for it. And they were advocating with their friends and family and their networks and everything like that. And I think really gave a jump start to the adoption. So if there's anyone that participated in our beta testing, we give you our sincere thanks.
The biggest surprise for me about this app was probably around the versatility and roles and how people were taking on tasks that were not necessarily in their wheelhouse and excelling at doing that in order to deliver something that was going to work well for people in Canada who were using this service, and to just kind of be able to be motivated and keep up a very strong sense of impact and the urgency in order to get this out and actually help people, but to also do it in a way that we were going to ensure that we were making the right thing for the right reasons, that we're going to serve the right people. And when we look at who are the right people, we need to make sure that that is reflective of all people that are here in Canada using this and who are impacted by COVID-19 in the best ways that we can. And so that collaboration and the ability for people to challenge themselves and just go with it and try new things and be able to hold ourselves accountable to that and do that at a really high level was an amazing exemplar to see. And I think it really surprised a lot of us. And the fact that we were able to pull this together and do this in a way that had a positive outcome and that is continuing to do that and has had an uptake of almost 5 million people in Canada. It's a pretty large scale for people who are creating government services in the app sector. So it's really interesting to see, and it's been a really fun and wonderful process to be through.
The biggest surprise in building this service was just how much the public has also supported our communications efforts about the app. It really warms my heart to see total strangers make videos on social media, write blogs, send tweets, comments, create great graphics, all encouraging their peers to consider downloading the app. They've been doing quite a bit of myth busting of any misconceptions about the app as well. And that support has been wonderful because the way that we build trust is when a person that you trust is also supporting the app as well. We ultimately know that we've still got more to do. We've just done some work on mapping out different users' mindsets behind using the app, which delved into how interested versus disinterested or trusting versus distrusting users may still feel, and how we can better address some people's concerns. We're also actively doing research to learn how to improve access to COVID Alert as well. So that means learning about personal experiences with connectivity and limitation issues, bandwidth limitation issues, access to technology like phones and computers, access to healthcare and healthcare resources, healthcare information during COVID-19, and any overall concerns people might still have about using the app. We're also rolling out some new features to the app in the coming weeks, which aim to give people more granularity, control, and specificity while using the app. It's been exciting to roll out across 8 provinces so far, but our work is not done yet, and we need your help. So any feedback that we can get through social media or through digital.canada.ca would be super helpful. Thanks so much.